Hi everyone, I'm Dr. Chen from Joint Center International Eye Center. Today we'll be discussing age-related cataract. What do you know about the disease? The term cataract is now well known to many people. Patients with blurred vision always come and say, "Doctor, I have cataract and I need eye drops and medications for my disease." Actually, there are some misconceptions about age-related cataract. After we finish this session, I hope you can describe the classification and clinical features of age-related cataract and the general principles of management. First, let's go through the anatomy of the lens. The lens is spanned behind the iris by the zonular, which connects it with the ciliary body. The lens is biconvex, avascular, colorless, and almost completely transparent structure containing capsule, cortex, and nucleus. The lens grows throughout the eye. It is responsible for accommodation and is an important part of the refractory system of the eye with a 19 dioptric refraction power. By definition, an age-related cataract is an opacity in the lens that develops with age. According to WHO, cataract is the most common cause of blindness in the world. The pathogenesis of age-related cataract is complicated. It is thought to be related to oxidative changes, ultraviolet damage, and malnutrition. The prevalence is very high in the elderly. It is higher than 60% among people over 70 and about 80 to 100% in those over 80 years old. This picture illustrates the classification of age-related cataract by the main location of the opacity. It can be divided into cortical, nucleus scleral, and posterior subcapsular cataract. There are different stages in the formation of cortical cataract. During the incipient stage, the opacity starts as clefts and vacuoles between lens fibers due to cortical hydration. Subsequent development results in typical wedge-shaped opacity and the lens volume increases. We call this intumescent stage. When the cataract matures, all the cortical fibers become opaque. The lens is completely white. In the hypermature stage, the lens has a shrunken and wrinkled anterior capsule due to water leakage. Sometimes we may find a Morganian cataract in which the lens cortex has totally liquefied around the nucleus to seen inferiorly. Nucleus scleral cataract is characterized by a yellowish change due to the deposition of urochrome pigment. The nuclear density increases with age. In the late stage, the nucleus appears to be brown or even black. In subcapsular cataract, the opacity usually lies just in front of the posterior capsule and has a granular or plate-like appearance. As it develops, the opaque area will enlarge. The opacity are swollen migratory lens epithelial cells. Due to its location at the nodal point of the eye, a posterior subcapsular opacity often significantly impairs vision. Patients with cataract often complain of bilateral but asymmetrical cloudy or blurred vision. They may have reduced contrast. The contrast sensitivity is the ability to detect subtle vibrations in shading. The patient sometimes can point out the direction of letters in the visual chart, although they are blurred. The development of cataract may increase the dioptric power of the lens by changing the refractive index due to increased concentration of main intrinsic polypeptide, especially in nucleus scleral cataract. Cataract may cause a mild to moderate degree of myopic shift. It will also result in greater absorption of blue and violet wavelengths, so perception of these colors will decrease. Some patients may report increase in glare or have double vision. These are due to the varying degrees of opacities, hence refractions in different areas or layers of the lens. With the history and the opacity in the lens under slit lamp examination, we can easily make the diagnosis. A red reflex evaluation is also a rapid way to detect cataract. In a normal eye, we can see the light reflex on the red retina with a direct osmoscope. Cataract can cause the red reflex to be dim or even lessen. Mydriatic examination with pupils dilated is necessary to evaluate the severity of cataract and to find out additional changes, such as macular degeneration. We need to find out how much the cataract contributes to the vision loss. Research on pharmacoreversal of cataract is still ongoing. No commercially available medication has been proven to delay or reverse cataract formation in humans. Aldose reductase inhibitors, which blocks the conversion of glucose to sorbitol, have been shown to prevent cataract in animals. However, studies in humans show no such effect, as antioxidants do not slow cataract progression. Surgery is the only effective treatment for cataract. In the past, the indication for surgery is visual acuity less than 0.3. Nowadays, we do cataract surgery if the patient wants to have better vision. The decision to operate is not based solely on a specific level of reduced acuity. Key to decision is whether the patient's sight will improve significantly after cataract surgery. So how are cataract treated? Phaco emulsification is the modern cataract surgery. It is the removal of cataract by liquefying the aphatic lens into smoke fragments with ultrasonic vibrations and then extraction it by suction through the phaco probe. It is performed under topical anesthesia. In the surgery, we need to make a main incision and 1 to 2 auxiliary incisions at the cornea. These incisions are very small, less than 3 mm, and are often self-sealing and are left to close on their own at the end of the surgery. Then we inject viscoelastic agent to support the anterior chamber. The next step is continuous circular capsulorrhexis. It means to make a circular opening at the anterior capsule of the lens. Then we perform hydrodissection and hydrodelineation to separate the capsule, cortex, and nucleus. The next step is cataract removal. You can see the phaco probe and chopper how to chop the lens into smoke fragments and remove the lens by suction device of the phaco machine, left the posterior capsule intact. Cataract surgery resulting in aphakia. At the end, we need to inject an artificial intraocular lens into the capsule. Finally, we remove all the viscoelastic agent and close the incisions. Cataract surgery with intraocular lens implantation has an excellent success rate in both improving visual acuity and visual function. More than 90% of otherwise healthy eyes achieve a best correct post-operative distant visual acuity of 20/40 or better. In summary, age-related cataract is the opacity of lens with increasing age. It can be divided into cortical, nuclear scleral, and posterior subcapsular cataract. Besides impaired vision, patients may also complain changes in perception of colors and visual quality. No medications can reverse lens opacity. Surgery is the only effective treatment for cataract. That's all for today. These are the references. Thank you for joining us.